recent years, there have been multiple shocking instances of relatively young and seemingly healthy people with no history of serious medical illness or heart ailments dying of sudden heart attacks. In the latest such episode that has raised alarm, a 41-year-old renowned cardiologist in Gujarat died in his sleep after suffering a heart attack early Tuesday morning. Dr. Gaurav Gandhi is credited with having performed thousands of heart surgeries. Dr. Gandhi worked at the Guru Gobind Singh Government Hospital in Jamnagar. According to the police and his family, Dr. Gandhi had wrapped up his hospital schedule after seeing some patients on Monday night, returned to his residence, had dinner, and went to sleep. The family noticed no discomfort or change in his behavior, neither had he mentioned any problem that night. The family says he was fit as a fiddle. But Dr. Gandhi did not wake up the next day. The family rushed him to a hospital where he was declared dead on arrival. Doctors said the cause of his death was a heart attack. Ironically, the 41-year-old cardiologist was associated with the Halt Heart Attacks campaign on Facebook and actively promoted awareness and preventive measures against cardiovascular diseases. As we said, the past few years have seen many such sudden and shocking deaths of young people. A bevy of actors such as Siddharth Shukla and Puneet Kumar, filmmaker Raj Kaushal, singer KK, comedian Raju Srivastav and many other celebrities have had untimely deaths due to heart attacks while they were in their 40s or early 50s. Many have wondered if these heart attacks are linked to COVID, or is it related to modern lifestyle diseases, excessive exercise at the gym, in some cases a sedentary lifestyle, poor eating habits and stressful work lives. Just why are so many young people dying of heart attacks? And what can you do to maintain a healthy lifestyle? Dr. Manoj Kumar, let me start with you. Of course, sir, there are many factors that heart attacks are generally attributed to: an unhealthy lifestyle, lack of a balanced diet, stress and work pressure, difficult and long work hours, lack of sleep, excessive drinking, late nights, sedentary lifestyle, in some cases excessive exercise, obesity, and a family history of heart diseases and diabetes, as was just pointed out by Dr. Naresh Trehan in that interview to us earlier. But what has caused alarm in recent years are these deaths of relatively young people, barely in their 40s, some of them in their early 50s, with no history of any serious medical illness or heart ailments, dying suddenly of heart attacks. What explains those deaths, doctor? Because that is something that is causing a lot of worry, to ordinary people. Taking the case of Dr. Gaurav Gandhi from Gujarat, ironically, this was a 41-year-old cardiologist who had performed thousands of heart surgeries, and his family says he was fit as a fiddle. He suddenly dies of a heart attack in his sleep at the age of 41. How do you explain this?
Yeah, first we should accept that landscape of cardiovascular disease is changing, especially in our country. As Dr. Trehan rightly said, that we have a premature coronary artery disease, and 10 years earlier we get all this blockage in the coronary arteries or arteries supplying the heart. But the conventional risk factors, which was pre-existing, like diabetes, hypertension, high blood pressure, high cholesterol level, lack of physical exercise, smoking, and positive family history, it was there. But what happened? And one thing I always tell on also, that if you're looking fit and smart, it doesn't mean you are healthy. It is not a synonym for your health. Especially your biochemistry is very important, your family history is very important. And recently, which has, that 50% of the patients who have heart attack, they are less than 50 years of age. So young heart attack patients are highly prevalent in our country. But you have seen in last 2 years what happened, that there are some newer risk factor emerges, like sedentary lifestyle, you rightly said, a lot of work stress and shift duties, especially the young generations, because there is a study which has shown that anybody who's born after 1970, they have higher risk of heart attack. This is just because their carelessness about the right lifestyle and lack of exercise, and they are not very uh, uh, alert for the risk factors for the coronary artery disease. What happened in the last 2 years, that is a COVID pandemic, and COVID primarily a lung disease or COVID pneumonia. But what happened with the COVID? COVID has eroded the lining of the blood vessels, that is called endothelium. It has a very huge effect on the vessels of the arteries, and that is the reason that we are getting so many cases of heart attack. And there is a data published in Nature journal that 1.3% of the patients of COVID-19, they have chance of heart attack. So if you see, there are 4.5 crores patients in positive COVID cases in our country. You just calculate that even 1% number is very high. And as a per definition, if you see the sudden cardiac death is the death which occurs within 1 hour of symptom onset. What happened with Dr. Gandhi, that he had some chest discomfort. He went to the hospital. That is based on the personal communication with his friend. That he had two ECGs, which was absolutely normal. So he came back to home and he suddenly collapsed in the bathroom. So I want to emphasize that getting a normal ECG at the time of chest pain does not exclude your cardiac event or cardiac disease. So every time we emphasize that you should wait there for 24 hours, because he was a very learned and popular cardiologist. I don't want that about any comment on his judgment, but every time when you see the ECG and two serial ECGs is normal, then you think that it may be just a non-cardiac chest pain or something related to indigestion or acidity. But I will just share with the viewers that definitely the things are changing. It is now a heart attack or heart disease is not a disease of elderly. It can happen any age. I have personally done an angioplasty of a 18 years old child who has extensive heart attack. So things are changing, and definitely COVID has played a very important role, because COVID, the basic mechanism, COVID had damaged the lining of the blood vessels. It has increased the propensity of clot formation in your arteries, and there are some other mechanisms like autoimmune mechanism. We are not very clear, but at least we are sure that it damages the endothelium, and
Right.
that is
That
responsible for
is
the
very, very
heart.
worrying, Dr. Gilada. Nobody is suggesting that young people have never died of heart attacks in the past. If we could have Dr. Ishwar Gilada up on the screen, please. I'm sure that those instances have taken place in the past as well. But you might agree, Dr. Gilada, that since the COVID pandemic erupted in 2020, we have heard of many, many more cases of relatively young people dying of sudden heart attacks. People in their 40s, people in their early 50s, sometimes barely in their 30s. And these were also people who had no history of heart ailments. Therefore, I have to ask you this, doctor, because this is causing a lot of concern among people. Do you believe, like Dr. Manoj Kumar does, that COVID is a big factor that is triggering heart attacks in young people?
Thank you very much, Neha, for having me on the show. My forte is not cardiology. So what Dr. Trehan and Manoj says, I second that. But what I would like to see and say about the COVID, long COVID, which is post-COVID,
Yes, sir.
that
You're
there
an
are a lot of
infectious
issues
diseases
in.
expert and you understand,
Yeah,
COVID
yeah.
better than most others, which is why
Yeah.
we
So
thought of talking to you.
what I'm
Yes.
saying, what we have seen in COVID patients
Yes.
who had even a silent COVID, with not admitted in hospital, not even detected as COVID, but now we see antibody positive. There are multiple problems. Cardiac problems, one of them. Brain problem. People say my age, my friend. Okay, my age is 65, but my friend is also 65. I don't have any problem, but my friend has already got kind of a old aging problem, tremors, Alzheimer's, forgetting something, sitting numb. Then there are problems cropping up with sexual problem, erectile dysfunction. Then the problems coming with the brain concentration. Now, what is happening basically? Just to give you two analogies. Number one, we small thing for say computer which is costing 30,000, we give annual maintenance contract. Air condition costing 20,000, we give annual maintenance contract. Or even car which is costing 5 to 10 lakh, 15 lakh, we give annual maintenance contract. But our body costing more than a crore, 2 crore, 5 crore, depending on what you do. We do not do any AMC. We do not do CMC. We always think that if doctor suggests something, you do this thing, or ये तो अपना दुकान चलाने के लिए बोल रहे हैं. So this is something wrong. People should understand one thing. Secondly, like any pipeline in the building, you have a pipeline inside you. So if some building has a pipeline good for 100 years, and some building even 10 years, 20 years, you will get kind of choke up. So same thing is happening now, and that is because of food habits, not doing any exercises. Work from home is a big disease. People don't understand. And work from home is work from a bed, work from a chair. You want to have coffee, tea, breakfast, lunch, dinner only there. You don't want to walk 10 feet. So this is something is going to kill people. People should understand one thing. Just being born in India, your life is 10 years less than if you're born in Canada or New Zealand or Australia or USA. So by just being born in India, if life is 10 years low, why you want to reduce further? Expand it further. So we should take all kind of measures, whether doing exercises, eating proper food. People are not drinking enough water. Every day I see out of my say 15, 20 patients, I see 10 patients do not have their kind of blood pressure above 100. So the simple thing is drinking water. They don't drink enough water. And in summer, we see people going up to 80, 50 blood pressure. At 70, that person will collapse. But people don't understand. So I think we should make good campaign to understand long COVID, to understand the effects of if you had already treated with COVID and remdesivir, etc., have been given to you. Then people taken vaccine. Some of the vaccine effects are there. So we understand COVID during acute phase or little bit acute on chronic phase, but we do not know how long this will linger on, how long it will affect, which part of the body will affect more. So I think we should understand, and these are the markers to understand that if cardiologist can die of a heart attack at young age of 40, 41, you are nobody, you are not a Superman. So think of all those things, change your lifestyle, do exercises, do walk. This COVID has taught us one thing, that we should be having a good immunity. But as soon as COVID has gone, immunity has gone to dogs.
Yes.
Your exercise has gone to dogs. So you are not doing anything. And those who were used to even walk and exercises earlier,